Hey guys, I'm with Dr. Hilliard today. She's Beemo's vet. She's going to be explaining a little bit about Beemo's his procedure and what they did and what he has.
All right, so hi, I'm Dr. Hilliard and I am Beemo's vet. So Beemo has something that's called IVDD, or intervertebral disc disease. And there are 3 different types, and the type that Beemo has is called type 1. What that means is he has what's called an extrusion of one of his discs that's in his vertebrae. And so what happens, that can be due to trauma, that can be due to just a low underlying congenital condition. And over time what happens is normal behavior, normal wear and tear makes it sort of a little bit worse over time. And so there's this low-lying inflammation that just gets worse and worse and worse, and the further it spreads out, the further it affects the spinal cord. And what happens with these dogs is usually they present to us not walking or having an ataxic gait, a kind of a drunken gait. Sometimes they don't feel pain in their back legs anymore. Sometimes they don't have what's called reflexes. So like when you go to the doctor, they hit your knee. That won't work on these dogs sometimes. And so depending on how they present to us, if they can still feel pain, if they still have motor, so meaning they can still walk a little bit, sometimes we can manage them with just medication and cage rest. It makes them super bored and it's not fun for the owners, but sometimes these dogs get better and we don't have to go further. Unfortunately, sometimes these dogs just, their symptoms and signs get so much worse, that no matter what we're trying to do to combat it, unfortunately, they're just going to keep progressing in their disease until they need surgery. And that's what poor Beemo needed. So we tried first with medical management, and unfortunately his disease wanted to progress really quickly. And luckily his marvelous owner was watching him vigilantly and took him at the right time and had the surgery done. So right now we're just waiting to see if he can relieve his bowels on his own and urinate on his own, and we're really waiting to see if he can walk again. My hope is that we caught it early enough and we're able to have him in surgery soon enough to where we will see him walk again.
Yeah. Thank you, Dr. Hilliard.
You're welcome.
Really appreciate it.
Of course.